Welcome to Taking Control of Your Diabetes. Today we're talking about sex, sexual health, which is such an important issue for people with diabetes and their partners. Sexual health is so important for our sense of well-being, quality of life, and self-esteem. For most of us, discussing sexual concerns is difficult to do with our partners, and that's especially true when we're talking to our healthcare providers, who, by the way, have had very little or no formal training in this very important area of medicine. We're fortunate to have with us today an internationally known specialist in sexual health, Dr. Irwin Goldstein. He is the Director of Sexual Medicine at Alvarado Hospital right here in San Diego. Welcome, Dr. Goldstein.
Steve, you are awesome. It's so cool to talk about sexual health. I'm so excited.
Well, let's start off with a definition. You know, for most of us, sexual health comes down to ED or no ED. And I know it's much broader than that.
Well, so sex engages your interest in wanting to have sex, then the response is an arousal. So in a man it would be an erection, in a woman it would be pulsation, throbbing, engorgement, or swelling of tissues. That continued stimulation would lead to an orgasm. And then if there's any pain or anatomic issues involved. So it is broader than ED, and people with diabetes, sadly, have a lot of sexual health issues.
Well, let's go to that next. Obviously, there's a lot of different issues that we can talk about, but let's first talk about what is the magnitude of the problem with people with diabetes. And I really want to emphasize on today's show that it's men and women, not just men, because that's where all the TV commercials are geared towards.
Well, soon we're going to have drugs for women, but we'll get to that in the future. It is definitely a man and a woman's issue, and in diabetes, it's exquisitely common. It's more than 50% of people have this problem.
Now, it's easy to measure, erectile dysfunction in a man, but it's a little bit more difficult in a female. In your clinic, what kind of questions do you ask, and what kind of complaints do you have when they come in to separate out, what the issues are?
Well, actually, we don't really measure the erection issue in a man. We just ask if it's hard enough and does it last long enough? Is it able to be functionally utilized? So we ask similar broad questions to women. Are they interested? Do they have an arousal response that they can relate to? Are they wet? Are they really dry and it sort of hurts to have sex? Are they able to get to be the orgasmic phase during the sexual event? So
it's really just
pretty broad questions.
Asking them the whole story between the beginning and the end, and then figuring out which problem that is. Well, one thing I think that is fascinating, and I've heard you speak about this, is the relationship between sexual health and typical medical problems. Now, people with type 2 diabetes and a lot with type 1 have a condition called metabolic syndrome, which is the combination of heart disease, high blood pressure, abnormal cholesterol. And it's amazing that really, when you think about it, that sexual issues are closely related. Maybe you can expand on that.
Well, absolutely, and I think we could make it really simple. You mentioned diabetes, you mentioned being overweight, you mentioned high cholesterol, you mentioned high blood pressure. So those typically gum up the plumbing works, as it were. And especially for a man who wants to be aroused and have a good quality erection, you need rapid onset of blood flow to the organ. So if the organ plumbing is a little blocked up, it would be pretty obvious that that person's going to experience at least that kind of a sexual problem called an erectile dysfunction.
Now, when you say plumbing blocked up, I mean, I assume we're talking about vascular disease,
correct,
blood flow issues. Let's talk about some of the other causes of sexual health issues. Neuropathy is one, and I know there's a whole laundry list.
Yeah, so to achieve orgasm, it's nice to feel and get good sensation, and when there are nerve damage issues, not only could you not feel, but sometimes it could be a little painful. I think hormonal issues are really an important issue. You need to be interested in sex. You need to have desire, thoughts, and fantasies to even start the whole process. And it's really sad, but in metabolic syndrome, a very commonly associated dysfunction is low testosterone. I think that's got to be at least in 3 out of the 4 patients who have metabolic syndrome.
It's interesting because I'm not sure about the lay public, but in medicine, we don't talk about testosterone much. We know that in older men who come in with ED, we order testosterone, but tell us what the relationship is with women and testosterone.
Oh, very strong. Testosterone is as critical to a woman's body as is estrogen, and it's sort of thought testosterone, well, you're the boy's thing, and estrogen, you're the girl's thing, but that's absolutely not true. We have estrogen as men, and women have testosterone, and they both have their respective roles. Testosterone is very important in desire, bone, muscles, energy. A very important thing to have. In men and in women, testosterone does very important things for diabetes. It sensitizes insulin. It's so really important to have normal testosterone because you can lower your hemoglobin A1C, lower your glucose just by having normal testosterone.
Wow. Well, while we're talking about all the causes of diabetes and vascular problems, what about exercise in a nutshell? Is that important?
Oh, diet and exercise are critical for our sexual health world. The one that gets the most attention and the most peer review assessment is the Mediterranean diet. So it's a diet full of nuts and dried fruit and vegetables and...
Hey, Mediterranean, vacation, sex is
Yes,
perfect. Hey, well, let's go to Larry, who's going to give us a little bit of advice about how to exercise, get our blood flow going, and maybe improve our sex lives.
It's so important to maintain a good core to help reduce low back injuries for individuals. Today, Michelle is going to demonstrate use of a physio ball to actually improve muscle function, muscle strength, and endurance of the abdominal wall. Michelle is placing her hands at her shoulder level or at the side of her shoulders, but we're kind of refraining from putting the hands in back of her head because this can add excessive strain onto the neck. Michelle's taking back and moving forward, blowing out each and every time that she comes up in each of her curl-ups. Michelle's feet are flat on the floor, and what this helps to do is help to improve abdominal strength and endurance, which is important for core muscle function. If you don't have a physio ball, you can do these types of activities at home where you can use a mat, and you'll lie flat on the floor with your knees bent and feet flat, and you'll place your hands at your shoulders, and you can curl up, and all you're needing to do is get your back up off the mat, your shoulders up off the mat. That's all we're trying to do. For those that are a little more advanced, you can curl one leg over and curl up, trying to touch your elbow to your knee. So again, these types of activities are good for the core function, core strength, and reducing injuries. And for more information, you can go to ucsd.tv website.
Thanks, Larry. Well, while we're talking about exercise, I think it's so important to keep our weight down because I know obesity can affect your heart, but how can it affect our sexual health?
Obese people commonly have sexual problems. And what's even more interesting is when obese people go on testosterone, they actually lose body fat and gain muscle, which is really important. And people who go through these bariatric surgical procedures actually regain their sexual function. It's really sort of interesting.
And I know there's always the physical barriers as well. So I just want to make that point that when people are overweight, the fat cells of our body make hormones, and so their testosterone levels are lower.
Right.
So it's not just a bulk issue. Well, let's talk about one of the most significant problems that relate to sexual health, erectile dysfunction. So tell us a little bit about erectile dysfunction in men and women, the typical, the ways you approach it, and maybe some of the therapies.
So this would be the aspect of sexual health that involves arousal. So in men, it would be inability to obtain a sufficiently rigid erection to allow for physical penetration. For women, it would be dryness and low swelling and pulsing, throbbing feelings. So it's a problem that is primarily directed from nerve impulses and then translated into blood flow. The requirement that a lot of blood flow be in genitals is really an important one. So we talked about artery clogging, so that could happen in both men and women. Just an aside from the women, we just had a brand new report which came out in the recent journal publication that women who are premenopausal, who have metabolic syndrome, so the heavy and the high blood pressure.
Type 2 diabetes, yep.
Right. They have lower sexual function. So it's the first time we're seeing that. Metabolic syndrome, obesity, low thyroid, and high cholesterol are all now, for the first time, physical attributes pointing to women's sexual health. We knew that for men for years. The bottom line is that you need to be aroused to end up having a better sexual sense.
You know, it seems like everything bad is associated more in people with diabetes. I'm really tired of that, but all we can do is try to prevent it and treat it. Now, if one of our viewers is out there and they've had problems with arousal, men or women, how do they know if it's more of a psychology issue versus biology, a problem with nerves or blood vessels? Because I know that depression may play a big role in the ability to get an erection.
Very much so. And I just had a patient who walked in the office who was on the antidepressant drugs are called SSRIs.
Like Prozac type of drugs.
Prozac, Paxil, and they raise serotonin, which is helpful to the depression. Serotonin, sadly, is the most aggressive, most active inhibitory agent in sexual activity. So what's good for depression therapy may not be good for sexual function. But this patient walked in, we did an evaluation which involved testosterone. And low testosterone can be associated with depression. So I suggested we start the management of the sexual health issue with testosterone. And guess what? Not only did she have better sexual function, she wasn't depressed anymore and was able to get off the SSRI. So we actually killed two birds with one stone by getting the sexual health issue dealt with.
Well, I was going to say that, you know, sometimes it's hard to tell which one comes first, depression or sexual issues, because it's such an important part in our daily lives. Well, what about Viagra, Levitra, Cialis? We know that it really helped take men erectile dysfunction out of the closet and has helped lots of folks. Well, tell us about that, and then let's transition to the women, because, you know, I've heard from my female patients that for some of them, it seems to have helped them as well.
Oh no, we're strong users of both agents. They're called phosphodiesterase type 5 inhibitors. The examples are Viagra, Levitra, and Cialis, and they increase blood flow. They require that the person has normal testosterone. So that issue is more easily available in a man. It's less available. Women tend to have very low testosterone. But if we treat women with testosterone, they do respond very, very well to the Viagra, Levitra, Cialis agents. And we have nice new data on that. In fact, we just have data published in a large journal of women who have depression and have SSRI use and get sexual dysfunction. They can actually take Viagra as the antidote for that.
Yeah, now, do you recommend getting a testosterone level in men and women before approaching this therapy? Because a lot of patients may want to ask their caregiver to get a testosterone level. I know men have pretty set levels, but are there set levels for women depending on their age and
pretty much it's the same, and it's about 10% of the value of a man. So if a man's around 400, 500, which would be a good number, so 40 or 50 would be a good number for women.
And that level is the same for most hospital laboratories? I know it's different when we come to A1C and things like that.
It's pretty much standardized in the United States.
Now, let's talk about low sexual desire, because that seems to be closely tied in with erectile dysfunction.
So if you don't arouse, you tend not to be interested. And that's what you're talking about, which is the low desire. Well, as we took impotence out of the equation, impotence is now a historic word. We now use the word erectile dysfunction, and the acronym is ED.
We use it for our politicians, but maybe not for sexual health.
That was good. We don't use the word low desire or low interest or low libido anymore. We now have a new acronym called HSDD. And why this is important.
Hold on, I better write that down.
Hypoactive sexual desire disorder. And the beauty of HSDD is we have an awful lot of information coming out of the basic science world and the clinical world, and we now have a drug which is at the FDA, which is hopefully soon to be approved, and it will be, amazingly enough, approved for women, eventually hopefully for men, but it will be the first FDA-approved product for the treatment of a woman who has a sexual health problem.
Wow, that's interesting. Well, hey, let's go to Janice, who's going to tell us how chocolate may improve our sex lives.
My name is Janice, and today we're going to talk about the love of chocolate. You know, many people with diabetes think that chocolate's off limit, but actually it can be part of a healthy diet. What I typically recommend is using chocolate in small amounts, but the good kind, namely dark chocolate. Maybe taking a few chocolate chips and sprinkling it on top of yogurt or hot cereal, or pairing up chocolate with some healthy foods such as raw almonds or some fresh fruit. Since chocolate is a romantic food, think of it as part of a very healthy diet that can enhance your romance. For more information, go to ucsd.tv.
Hey, thanks, Janice, for that tip on dark chocolate. But for those of you on insulin, remember, you may need to cover yourself for that a little bit. Now, Erwin, I want to come back to something. Traditionally trained doctor like myself always needs to separate out psychological issues versus hardcore vascular nerve damage. And as I understand it, there may not be that separation.
Yeah, it's sort of old school to do that because it's so mixed. We have a biopsychosocial model. We recognize and have in our facility a psychologist who sees all patients, follow up and at the initial visit. And we manage them with as many of the biologic items as we can. When we discussed HSDD, for example, it's a situation where if you take the brains of women and men who have HSDD versus control, they have markedly less blood flow to the parts of the brain that initiate their sexual activity. So it's sort of, does that come from anxiety? Does that come from depression? Does that actually come from vascular disease? Does that come from biologic issues? I mean, at the end of the day, they're just not getting blood flow to those parts of the brain. So the new drug actually rebalances the imbalance, increases the excitatory chemicals, and lowers the inhibitory chemicals. Very clever.
This is the new drug that's at the FDA for the treatment of
HSDD, yeah.
Low sexual desire. I haven't got that mnemonic down yet. Now, but the other thing that you mentioned earlier was that drugs like Viagra, Cialis, Levitra, which cause vasodilation, may also help a psychological issue as well. Is that true?
Well, it's not a psychological issue, but what we used to think as a psychologic cause for the sexual problem, we can still give Viagra and it will help. It's because it's hard to distinguish A from B now, and we just sort of treat them as one.
Okay, let's talk about the last major issue, is orgasm. As we spoke before the show started, that it is a huge problem, and you actually have an orgasm team at your sexual medicine clinic. Tell us about orgasm.
So orgasm is the reward. It's the satiation that follows the event, and it's really a desired part, and to fake it is sort of really problematic. So people who can't achieve orgasm, it's a big issue, and there's not a lot of doctors knowledgeable, not a lot of information out there, but we have put together, we call it the O team, to deal with people who have their orgasmic dysfunction. So I will deal with their biologic issues. We have a healthcare provider that's very interested in vibrator therapy, and vibrators would provide needed sensory information to the brain to activate the orgasmic response. We have a coach that deals with emotional intelligence and better knowledge of your moods, and we have a physical therapist because, again, orgasm is pelvic floor contractility, and men and women who have weak pelvic floor muscles have very limited orgasmic response. So it's actually an integrated biopsychosocial model for treating yet another sexual health problem.
It's interesting to me, from the lay literature, it seems like, and I could be wrong on this, you'll correct me, women have a problem obtaining an orgasm, and a lot of men have premature orgasm. Is that a misconception, or is that a generalization that's true?
No, I think your statements are correct. In women, it's a little more difficult to have an orgasm because, in essence, they're dependent upon the partner often, and the partner, if he has premature ejaculation, really doesn't give the woman enough time. But there are men who can't have orgasm and women who can't have orgasm.
Now, when you see these patients, I would imagine that you see them with their partner at the same time. That's probably pretty vital.
Ideally, but in some situations the partner is a little overbearing and not allowing the partner to really express the partner's views. So you have to play it by ear. It's usually better to have the couple.
Are there any other type of medications coming out to help with orgasm? I know we talked about low sexual desire.
So we're doing research in all areas. I'm working on orgasmic agents currently. The most close to the people out there getting access to a drug is the HSDD drug. Flibanserin, Flibanserin, is a drug that rights the imbalance, the excessive inhibition to make it more excitatory.
It sounds like a very important addition to our whole medical armamentarium. Well, let's talk about one of the most important things, which is education. If you were designing a medical school curriculum and residency program, you know, what's missing and what would you add?
At least 1 hour of sexual health for doctors?
For 4 years.
We're here at UCSD. There's not a single hour in the 4 years for sexual health. It's so sad. And that's like that all over. So, yes, we need to train doctors better. But you know what? Your TCOID, God bless you, really does educate patients as to their opportunities, how to get help. It's awesome. And that's the kind of stuff we need.
You know, I think, thank you very much. You know, one of the whole concept behind our organization, Taking Control of Your Diabetes, is really to educate the person living with the condition. And I think this is the type of issue that you've really got to be your own self-advocate. Now, as I mentioned in my introduction, it's difficult to talk about these issues, not only with your partner, but especially with your healthcare provider. What would you recommend to our viewers if they are having sexual concerns? I mean, I would say if you live in San Diego, I'll be first in your clinic tomorrow morning. But if you don't live in San Diego, I think that's an issue because there aren't that many centers like yours.
So you have to be your own advocate, and I think the internet is probably one of the better ways. I hate to say that, but your primary care doctor is obviously the way to go, but sometimes that's a roadblock. So be your own advocate and push. You can write, I have erectile dysfunction and I live in Peoria. Who do I see? And you'll be surprised at how many experts come up in the area.
Well, one important biologic function about sex is to have kids. Let's go to our kids and hear what they have to say about living with diabetes. Did any of you guys have a girlfriend?
I did, yeah.
So how'd that go?
She was fine with it. Like we were friends before.
Did she know that you were diabetic?
Yeah, yeah. And I told all my friends, and they all knew. And we've all been friends since like elementary school.
Most of my friends, they're really supportive. Like if my sugar gets low and I'm acting kind of weird, they tell me check my sugar, or they know what's up. And then some people, a lot of people, they tease me about it. But then all my friends, they're like, you shouldn't do that because it's not right.
My friends, they sometimes walk me to the nurse at lunch every day when I need to go test my blood at lunchtime.
They just keep you company.
Yeah, they're really supportive.
And just recently I've started like letting people in and like just keeping it open, like testing and giving insulin in like one of my classes and stuff.
I'm always open. Ever since I got it, I'm like, hey, guess what? I'm diabetic. You know, I've only been harassed about it like once or twice, and I just say, you know, you must have no life, you know.
I've never had anyone that like I wasn't friends with come up and say anything. And yeah, if anything, like a lot of kids are more interested than like thinking that you're weird or anything. Like if I'm checking class, kids be like, oh, what are you doing? Oh, like, you know, I don't care. I like to tell them about it.
Before I got diabetes when I was 4, I was friends with Matt, and he got it when he was 2, and I always was like interested with it and stuff, and I just asked him about it, but then I got it like when he moved away.
Yeah, he gave it to you, that's it.
Yeah.
So that's also like one of the plus sides, is you get to meet so many other people and just like build kind of a community.
The kids sure say it like it is. Well, or when we're getting to the end of the show, give our viewers some words of wisdom to take home.
Well, first, I have to thank you so much. The opportunity to talk sexual medicine in a public forum is awesome. We don't get to do this very often, and this is really important. You know, sexual lives are about intimacy and sharing, and they're just very important things. And when sexual lives go into dysfunction, a lot of people just give up. They're embarrassed and they're frustrated. So this time that we've had a chance to share has been very helpful. I want to express the emphasis that people don't give up. If they want to not retire sexually, they want to encourage and get involved in sexual activity again, sexual health physicians are around the country, and it's very important that they persist. They become their own advocates.
Thank you so much. Well, in closing, I'd like to encourage our viewers to remember, you have the main responsibility for taking control of your diabetes. You are your own best advocate. Be smart and be persistent. So until next time, take control of your diabetes. You owe it to yourself and your family.
day.